welcome to this weekend's episode of the Lifestyle Edit, Beauty and the Body, where we're talking to you all about beauty, beauty standards, body and so much more. I'm Chaiti Narula, and what an apt place to do this episode. We're at the Face Center in the National Capital, and the first story that we have for you today is on skinny pens that are a rage in Hollywood. Most people are taking it who are celebrities and losing weight rapidly, but they're just not admitting to it. Elon Musk, Amy Schumer have admitted to it, and Jimmy Kimmel recently joked about it at the Oscars 2023 as well. Now, Ozempic, Mounjaro, Wegovy, out of which Ozempic and Wegovy are semaglutides, and they help you lose weight rather rapidly. But doctors feel Mounjaro, which too is available in India, works much better because it works on your GIP and GLP-1 receptors, both with lesser side effects that are being observed in patients. So let's take a look at why Mounjaro is better and a new baby on the block, Tirzepatide, which is under clinical trial stage. When Elon Musk openly came out to share his weight loss secret, the Pandora's box opened up on how a spate of celebrities are rapidly losing weight to keep themselves in that Instagrammable state always. Most of them, like the Kardashians for example, have flat out denied taking any skinny pens and are only reportedly taking it. Amy Schumer recently admitted to taking Ozempic, and Jimmy Kimmel joked about A-lister's secret weight loss treatment at Oscars 2023.
Everybody looks so great. When I look around this room, I can't help but wonder, is Ozempic right for me?
Ozempic and Wegovy are the same drug and are not any different. They both contain semaglutide. Ozempic is the brand name for the semaglutide indicated for diabetes. Wegovy is the brand name for semaglutide indicated for obesity. That's the difference. Despite that, Ozempic has been used extensively off-label as a weight loss drug. Wegovy is available in higher doses compared to Ozempic. Wegovy is FDA cleared for weight loss. Wegovy comes in a single-dose pre-filled pen that delivers a dosage of 0.25, 0.5, 1, 1.7 and 2.4 milligrams. Ozempic comes in a pre-filled pen that delivers a dose of 0.25, 0.5, 1 and 2 milligrams. These drugs are prescribed in India by many qualified doctors in urban metropolitan cities, mainly functional medicine experts, endocrinologists, some cosmetologists and internal medicine doctors too. Doctors who prescribe this weight loss drug in India find Mounjaro far better than Ozempic for weight loss in non-diabetic patients.
Mounjaro is a different molecule. Mounjaro is Tirzepatide. The difference is that semaglutide, which is Wegovy or Ozempic or Rybelsus oral, is a drug that acts through the GLP-1 receptor. By acting through that, it produces a plethora of effects which include better control of diabetes, weight reduction and other things. Tirzepatide acts through two receptors. It acts through the GLP receptor as well as the GIP receptor. So GLP-1 and GIP both, the single molecule acting via two pathways. So there's a difference there. So Tirzepatide seems to produce slightly greater weight loss than is seen with Ozempic or Wegovy.
Ozempic, Wegovy and Mounjaro. So all two of them are semaglutide and Mounjaro is Tirzepatide side. So Ozempic, Wegovy is semaglutide and Mounjaro is Tirzepatide. Ozempic and Wegovy are GLP-1 agonists and Mounjaro is a GLP-1 agonist plus it has also GIP agonist properties. So their basic structure differs, and Ozempic and Wegovy keep in one side because they're semaglutide, Mounjaro is on the other side because it's a combination of two.
Studies indicate Mounjaro, which is Tirzepatide, has better diabetes control versus Ozempic, which is a semaglutide. Not only is the weight loss higher with Mounjaro compared to any of the other drugs, but doctors say there are lesser side effects and lesser gastrointestinal complications.
What has been seen with the experience of use of many doctors that Mounjaro is not giving so many gastric side effects as compared to Ozempic and Wegovy. And Wegovy also is a little well tolerated than Ozempic. So, but everybody is different. So anyone can have any GI upset. And some people I've seen Ozempic, they take and nothing happens. Some people are very sensitive. So on the whole, I would say, first I would say Mounjaro, Wegovy, Ozempic in terms of the GI side effects.
Ozempic shot will cost you approximately 20,000 rupees per injection taken once a week, every week, for a period of roughly 6 months on an average. Every patient is different and the period and dosage will vary for each patient. If one is morbidly obese, then 6 months period of being on the injectable drug is bare minimum. The pill form of semaglutide is readily available and sold under brand name like Rybelsus. Rybelsus pills are available in 3 variations, 3, 7 and 14 milligrams, and one strip of 10 tablets will cost you approximately 3,000 rupees and upwards, making one pill cost you approximately 300 to 400 rupees. The pill form of semaglutide is ideally taken every day, once a day for 6 months to a year.
Pill, because the pill milligram is small, it is also activated upon by the gastric enzymes and the acids. So pill will always take longer for anything. It goes with for any medication. Pill always takes longer than the injection. Injection is directly subcutaneous and doesn't need the stomach gastric acids or nothing hampers with absorption. But with the pill, these things are hampered, so it's slower.
Pill versus injection, then the injection is more efficacious, given once a week, versus pill which is taken daily, because a higher dose of the medication is delivered into our bloodstream by the injection than by the pill. So it's purely a function of dose.
There are few who should just stay away from these drugs. Prescribing these to teenagers is a strict no unless morbidly obese.
Actually, all of the glutides mainly have a black box warning of thyroid C-cell tumor, so MEN2 syndrome. They are contraindicated, and we got to be very careful there because we are talking about cancer here. So unless needed, I would not prescribe it unless it's really, if we have to weigh risk versus benefit in some patients.
Patients with a history of medullary thyroid cancer or MEN syndrome or allergy to semaglutide are not advised to take it. In case of any history of chronic pancreatitis, docs do not prescribe it. In New Delhi, with inputs from Riya Modi, Chaiti Narula for India Today. Ozempic, Wegovy, Mounjaro, skinny pens, different pill forms of semaglutide all have side effects. One is the Ozempic body, where you end up losing rapid amount of weight and your skin starts sagging. The Ozempic face, same thing happens to your face. The Ozempic butt, and now the recent phenomena is Ozempic hair. So, although it is not a listed side effect, doctors are now saying because of a decreased nutrition to your scalp on the back of rapid hair loss, many people are seeing that they are losing hair while they are on these skinny pens or all these drugs. There are many fixes available. Where I'm standing right now is a hair transplantation center, so you can literally transplant your hair. Or what you can even do is go in for magic PRP. If you're scared of needles, you can go for stem cell therapy, exosome treatment. There are just so many options available. So if you're going through Ozempic hair loss or hair loss of any nature for that matter, this story is for you. After Ozempic face, Ozempic butt, Ozempic body, we're now staring at Ozempic hair. Are you confused? You may have heard of dramatic weight loss thanks to Ozempic, Mounjaro and Wegovy that has got the world in a bit of a tizzy.
It can cause vomiting, it can cause diarrhea, it can cause a whole sort of range of gastrointestinal. So those are the worst side effects. Another side effect which is less talked about because these molecules cause weight loss, which is predominant, but they also cause some muscle loss. They get shrunk, they feel shrunk, they're shrinking. That's very disturbing for people. Discontinue the medicine only for that reason.
Thanks to start sagging, one starts looking older, and even the quite an ouch moment. Now some people are does not sound pretty at all. A TikToker who lost 60 pounds while on it so much that she now has to cover it with makeup.
Ozempic hair. What's this new phenomena everyone's talking about? Ozempic hair follows the recent phenomena of Ozempic face and Ozempic body, where rapid weight loss is causing some sagging of the face, some sagging of the body, and even some cellulite. Ozempic hair is different. Ozempic hair is where the rapid weight loss is triggering hair fall. We all know people who have lost weight and their hair has fallen. That can also happen with any medication or pharmaceutical interventional weight loss.
While hair loss has not been officially listed as a direct side effect, one must understand all support forums are exploding with this concern, as with sudden weight loss, the body tends to take away essential nutrients from the scalp. Add nutritional deficiency to the mix thanks to the rapid weight loss, and you have a recipe for disaster, and that is called Ozempic hair. But fret not, there are some easy fixes. You can fix Ozempic hair, and that's the fabulous news. The Ozempic hair fix is readily available in India, a painless PRP without needles, growth factor concentrate injections, lasers, threads, stem cell therapy, amongst many others. While all of the above are painful, the latest painless PRP using jet peel technology is the only painless solution done once a week, every week for 4 weeks.
PRP is where we draw the blood, take the stem cells and growth factors, and put it under the skin to stimulate the hair. But typically it's done with needles. With Magic PRP, it is painless, no needles, no touch. We use air to infuse the actives deep into the skin, and so that the follicles are stimulated with just cool air and beautiful sensation. We do 8 sessions, 1 session a week. It's recommended to be done, and you see fabulous results, no downtime, no discomfort.
One session can cost you 25,000 rupees, and you need 8 sessions in total a week apart. Doctors are not very clear on the hair loss and feel it is probably thanks to a condition called telogen effluvium caused by semaglutide. What they're clear on though at the moment thankfully, is that Ozempic hair can be fixed fuss-free. In New Delhi, Chaiti Narula for India Today. You obviously go to the gym to tone and sculpt your body, but have you ever gone to a facial gym ever in your life? We're not talking about facial yoga and facial exercises. Nowadays, there are machines that help you work out. They are no sweat gym for the face. They work on your risorius muscles, on your zygomatic major and minor, on your frontalis muscles. And while we're at the face center, we're telling you how to work your face out. Here is a story on what technology can enable for you these days.
These little strips off and see how tight my skin is now.
How I feel about the results afterwards. You can see I'm all hooked up, ready to go.
It's like going to a gym for your face.
I'm going someplace tomorrow and I'm doing a treatment. It's called M-Face.
Well, I try some new technique that's going to lift my face.
So this is the process. What is this?
Fillers and Botox are so last year or even last year. Now you do not need fillers or Botox to get rid of your wrinkles or to sculpt your face. All your face needs is a good workout. Something that beautifies it inside out rather than just working on your face with needles. But hang on. You're wondering what exists in your gym for the face? So face yoga can never really give you the effect that technology can. because it is way too difficult for you to target the right muscles yourself and even engage them. M-Face is basically a gym for the facial muscles, and it's here in India now. Many celebrities have popularized it. Jessica Simpson, Alicia Silverstone, Jenna Devan, Drea De Matteo are all gymming their face now.
Groundbreaking procedure circumvents the needle for invasive needle-based intervention. It offers a safe, no needle and no downtime procedure which is quick and easy. Electromagnetic waves are sent deep into the skin using M-Face, encouraging the growth of new collagen and elastin fibers. This procedure reportedly contributes to enhanced facial muscle tone, augmented contours and a notable reduction in wrinkles.
It is a device that utilizes radio frequency and high-phase energies to work on your muscles. You feel your muscles contract and the skin tingles slightly in a funny way. It takes all of 20 minutes per session. The reason this is a no-sweat gym for the facial muscles is one, because when was the last time you exercised those muscles or engaged them in a workout? The high-phase technology restores and elevates support of the facial tissue by selectively contracting muscles and increasing density and quality of the muscle structure. Does that mean you lose some unwanted fat on your face too? Yes. Just like when you go to the gym and build a muscle that helps in fat loss, this does too, without making you lose so much that you start sagging. Also, the synchronized RF remodels and smooths the skin by heating the dermis and increasing collagen and elastin fibers that make the face much more lifted and taut.
Fat reduction requires very high temperature, like 43 degrees. The therapeutic temperature in M-Face is enough just to stimulate the fibroblasts and the prime muscles, but it is not that high to generate fat lipolysis.
One session can last you 20 minutes and cost anywhere between 65,000 to 1 lakh rupees depending on where you're getting it done. A total of 4 to 6 sessions are needed, each a week apart.
M-Face is not recommended for people with metal implants since metal can interfere with the electromagnetic waves. This caution is particularly relevant for patients who have compromised immune system also, or even any neurological disorders. Apart from that, pregnant, lactating mothers are also advised against engaging in such methods. It is also not advisable individuals currently undergoing any treatments with isotretinoin, individuals with skin infection, inflammations or with any history of skin cancer to undergo this treatment.
For the forehead, the frontalis muscle is targeted for a workout. For the cheek, 3 muscles, the zygomaticus major, the zygomaticus minor and risorius muscles are targeted. If you are worried about side effects or who should not do it, doctors are here to advise. The end result? Well, our verdict will follow soon, but doctors say it gives a lift to the full face and that includes your jawline too. In New Delhi, Chaiti Narula for India Today. Well, there is yoga, then there is photobiomodulation. Both are very good for anti-aging benefits. But when you combine both, that is red light and yoga together, you can get the full benefit of both the modalities together. Here is Nitika showing you how it's done. You may have heard of red light therapy, and you definitely have heard of yoga. Now the red light yoga therapy is a thing. The low-level light therapy is a treatment that uses low-level red light wavelengths to promote healing and anti-aging benefits. It involves exposing the body or specific areas to red light at a wellness clinic where you can practice yoga to enhance benefits of both the modalities. A combination of red light and near-infrared light is used. It is easily absorbed by the human body and penetrates deep enough to heal tissues. A usual session is about 30 minutes long. It can cost anywhere between 3,000 to 5,000 rupees. You will ideally need 2 sessions a week.
The presence of red light that enhances your yogic experience. So while you hold a pose or an asana, the red light ensures that the circulation, the collagen formation, the flexibility, the muscle recovery is all in place for you. Expose the maximum area of your skin for maximum results.
This helps fight oxidative stress that fastens the aging process by boosting collagen production. It can help with fat reduction, improvement of muscle recovery, joint pain management, help tackle inflammation, certain skin disorders, amidst others. Though there are really no major side effects, but do not extend the prescribed period as longer exposure can damage the skin tissue. Practicing yoga in an environment such as this in a controlled temperature helps you better perform breath work. The warmth helps increase flexibility of yoga stretches. The red light helps you release happy hormones and helps reduce stress.
When there is a controlled temperature, little warmth is there, your stretches are much more better. Red color is your mool bandha color. So they're trying to activate that color, they're trying to activate that energy. Red color will always release happy hormones, cool down you to a level, creating a nice mental health.
Anyone with open wounds, photosensitivity, pregnant women, cancer patient amidst others should not try this. It is a must to check with your doctor before you take this on.
I'm just done with my red light therapy. It was a 15-minute long session and I already feel so calm. It reduces the oxidative stress which accelerates the aging of your skin. It boosts the production of collagen, leaving behind a healthier and a young-looking skin.
With Nitika Gandhi, Lifestyle Bureau, India Today.
That's it from me, Chaiti Narula, on this weekend's episode of The Lifestyle Edit. And a big shout out going out to my producers, Riya Modi and Kshitija Gosavi as well. We'll keep bringing you all the latest from the world of beauty, skincare, wellness, fashion, and just so much more. Stay well, that's the only way.